Hello, I'm Glenn W. Hunter, and with me today, Dr. James George of Excel Physical Therapy and Wellness. And today we're here to talk about stiff necks. A lot of meaning into that. And Dr. George, what do you think when you hear the term stiff neck?
Stiff neck is, of course, the joint in the neck, the joints in the neck are stiff or they're tight. People are not able to move it. So when somebody wakes up in the morning and feel that the neck is locked, so they're not able to turn their neck to the sides and look up or look down, yes, that is stiff neck, of course, and the joints in the neck are tight and stiff. It's almost immobile, or there could be also spasm in the neck muscles, which is not letting the neck to be moved. And this is typically people wake up with such symptoms. That's why a person who wakes up with a stiff neck can be helped by physical therapists, and you can walk into a physical therapist's office to have treated for stiff neck.
You know, often office workers complain about neck pain. They can go to great lengths with pillows and massagers trying to reduce it. And in these cases, what are some of the more common problems that they're dealing with?
Yes, typically office workers, the way they sit at their work desk, the term is called ergonomics. The way they are, their neck is placed on top of their shoulders, whether how their upper body is placed, while they are sitting, how their arms and elbows and their wrists and fingers are all positioned at the work desk makes a lot of difference in them developing or not developing neck pain. And also sitting for a long time in one particular posture while at work can cause somebody to develop neck stiffness, especially a poor posture like this with a protruded chin. People are just looking into the monitor. They're so concentrated, right? And their upper body, that we call it the thoracic spine, is rounded. And this is a disaster. This can cause somebody to develop neck stiffness very easily. And it is advisable to get up and move around, every 30 minutes, at least for 20 seconds, just to move around, move your neck, or even in that sitting posture while you're at the work desk, just moving a little bit, move your neck. That will improve the blood supply in the neck and keep your neck muscles loosened up, and that can prevent somebody to develop neck stiffness.
Okay. So when is neck pain a symptom of something more serious, and when is it a problem in itself?
Yes, neck pain could be a symptom of seriousness when there is an involvement of the central nervous system, because the neck is close to the brain, right? Close to the brain, and from the brain goes a spinal cord, and through the neck goes a spinal cord. So any problems of the brain or the spinal cord, it can cause neck stiffness as well. For example, one of the examples is meningitis, where there's high fever, and the movement of the neck causes pain going down the arms and legs. That is a pretty serious condition, and that person needs to go to the ER. So when there is high fever, with the neck stiffness and the pain going down the arms and legs, it is an emergency and need to be the patient should go to ER. And there are many other reasons. For example, a recent injury, a fall, like a motorbike accident or a mountain bike accident, where there is a trauma and the person has a neck stiffness, especially they cannot turn past 45 degrees to either side. That is something very serious, need to be gone. That patient should go to ER or an urgent care and have an X-ray done to the neck, because the neck has a lot of nervous system. Basically, from the brain, your spinal cord goes through that.
Mm-hmm.
And any injury to that part of the spinal cord can cause a weakness of arms and legs. So that is a pretty serious condition, or even a respiratory arrest. So it all depends upon which part of the spinal cord can get involved. So there is a fall or trauma. It is serious and it needs to be taken care of, gone to an ER, and they need to do an X-ray or other workup to clear out whether there is any fracture or any other ligamentous injury.
Okay. As you know, homeopathy is an important part of your practice. When does that part of your practice apply to neck pain?
Yes, we know that neck stiffness or neck pain could also be caused by mental and emotional health problems like stress, grief, all these things as we know, we have discussed in the previous podcast videos that homeopathy can help heal mental and emotional health issues without
Mm-hmm.
any side effects. So once the correct homeopathy remedy is prescribed to heal the mental and emotional health issues, that could help decrease the neck stiffness. But it all depends upon whether the neck problem is caused because of a mental and emotional health issue, or purely it's musculoskeletal. Musculoskeletal is there is stiffness of the joints and tightness of the muscles. So then for that, physical therapy can be helpful. Even massage therapy, chiropractic therapy, or even acupuncture can be helpful. So it's all about. That's why we physical therapists have doctorate degrees now. You can walk into a physical therapist's office. We will do an evaluation, find out whether the neck problem is because of musculoskeletal issue, or it is something beyond that. Then, if we suspect that it is not because of musculoskeletal problem, we refer out to a physician or to the ER or urgent care.
Wow. So, in essence, there's a lot of moving parts to that, but the bottom line is that there is treatment that's going to be available. You know, as we look at, osteoarthritis, which is a disease that can impact different parts of the body, what is its connection between neck pain and joint pain?
Yes. If you look at the term osteoarthritis, osteo means bone, arthritis is basically inflammation of the joints causing degeneration, right? That degeneration, if you look at it, like for example, an infant or a teenager, I'm just giving an example. If the joint space is this much, as we get older, joint space narrows because there's not enough lubricant called the synovial fluid in the joints. So what happens is as the joints get closer, they kind of have more friction, more causing more degeneration. And there are many other reasons for somebody to have degeneration that is beyond the scope of this video podcast today. But anyways, yes, when somebody has degeneration that causes stiffness because the joint space is narrow, and what physical therapy can do is we have techniques to help loosen up the joint, and also we teach exercise to stretch the muscles so that the joints are not as narrow, causing more degeneration. So physical therapy can help with patients who have neck pain because of degeneration of the neck joints.
So, neck pain and headaches. Obviously, they both have to deal with the top part of your body, but when are they related and when are they separate?
Yes. When somebody has pain in the upper part of the neck and pain going down up to the back of the head and to the side of the head or even behind the eye, that typically could be upper cervical pain causing headaches. You know, the term is called cervicogenic headache. Now, how do we differentiate is when you move your neck to the sides, up and down or sides, or in a sustained neck posture, the headache is getting better or worse, right? Sometimes sustained posture. So if there is a change in neck pain, and headache with movements, then we can say that it could be coming from your upper part of your neck, the upper cervical spine. But there are many other reasons for somebody to have headache. We know that any central nervous system, your brain problems can cause headaches. Sometimes sinus problems can cause headaches, and we have discussed that in the previous one of the previous podcasts about various headaches. And so that when it is not something related to the neck, but it could be related to the central nervous system, which is the brain and the spinal cord, then that person needs to go to ER or urgent care and see a physician to have it checked. Still, if you come with a headache and we can, as a physical therapist, we can evaluate you and differentiate whether it is a musculoskeletal problem which is causing the headache or it is something else. And if it is something else, we can refer you out to the ER or urgent care or your physician.
So consequently, if an ounce of prevention is worth a pound of cure, what can be commonly done to minimize neck pain?
See, the way we have our posture plays a vital role. The way our head and neck is placed on our torso plays a vital role in developing neck stiffness and neck pain. So almost about 8 hours we all sleep and 8 hours we work. So that's 16 hours of our day, of our 24-hour day. So the way we sleep plays a vital role in developing or not developing neck stiffness and neck pain. And the way we sit, we discussed that the way we sit at the work desk and work also can be a predisposing factor to develop neck stiffness or neck pain. So we at Excel Physical Therapy and Wellness, we teach the proper way to lie down and sleep and the proper way to sit at your work desk. And also we teach stretching exercises and strengthening exercises to help prevent or even decrease the neck pain.
Dr. George, I mean, there's a wealth of information, and so much of this is really practical, especially when you think about people who have to go to work and earn a living and end up with repetitious activities that just doesn't free them from maybe being as healthy as they could. If they need to find you, how do they find you?
Yes, you can contact us by phone at 909-792-5050, or you can visit our website at excelrehabandwellness.com, and you can also search us on Google, Excel Physical Therapy and Wellness in Redlands, California. Thank you.
Again, I'm Glenn W. Hunter, and of course we have Dr. James George of Excel Physical Therapy and Wellness doing incredible work in the Inland Empire, easing pain, helping people be more productive, and frankly, enjoying the fact that they are living in Southern California. Dr. George, thank you again for your time, for your wisdom, your insight, and definitely for the way you impact your patients in the Inland Empire.
Thank you. Thank you, Mr. Glenn Hunter.